It's like, so I'm Peter Shalit. I was one of two investigators, and this poster presents the data on folks with less than 95% or less than 90% adherence to either Stribild versus atripla. It's a double-blinded study 102, which is Stribild versus atripla. In this study, everybody took only single tablet regimens. So they had atripla or placebo, and they had Stribild or placebo. So they took two pills at separate times. The atripla was at night, and the Stribild was sometime during the day with food. One was placebo, one was not. And most people had excellent adherence, but a small percentage had under 95 or under 90% adherence based on pill counts. Patients had to return their pill bottles at every study visit, so pill counts were used for adherence. The folks that had under 95% or under 90% adherence did have a greater chance of failure to suppress. So this is the data on folks with greater than 95% adherence and very high virologic success in this group. The people that had under 95% adherence had somewhat lower virologic success and higher rate of virologic non-suppression. And then the folks with the lowest adherence, which is under 90%, had still lower rates of virologic success, higher rates of virologic non-suppression, but still decent virologic success. Part of the aim of this particular sub-study was just to see if there was a differential between Stribild and atripla as far as rates of virologic success in people who were less adherent. And the folks that were the least adherent, certainly there was a numerical difference of 70 versus 56% of virologic suppression. The other part of the analysis has to do with drug resistance, which is what we don't want to happen when people don't have virologic non-suppression. And so these are the resistance analyses of Stribild or atripla in people that had virologic failure. Some folks were actually in the high adherence or the high adherence stratum that had mutations with resistance. These tended to be people that started with a high viral load or a low CD4. That was the other correlate to failure with resistance. But then the folks that had lower rates of adherence certainly also could fail with resistance, and the proportion that had resistance when they failed was certainly higher in the less adherent people than in the non-adherent, and then the very adherent people, because the more adherent people, there were just a lot more of them. So there were 4 cases each in the more adherent and 4 cases each in the smaller, less adherent. So the overall conclusion is just that Stribild and atripla do maintain a reasonable amount of efficacy in people whose adherence is less than 95 or 90%, although the efficacy does drop with less adherence, and numerically Stribild did better at the lowest adherence group.